Good day, everyone. My name is Manon Nemariri. I'm a health and safety officer. I do health and safety consulting, and the purpose of this video today is to assist the newly graduates and newly appointed safety officers on construction sites. I've seen there have been numerous questions of newly appointed health and safety officers asking what is required from them when they get onto a construction site. Actually, they do not know what they have to do. Obviously, your employer will give you some induction on the workplace and what you're exposed to. So, the first thing you have to do when you're at work, because most of the times, construction site, there'll be site establishment. So, which means you'll be given enough time to communicate with your engineers and you'll have an idea of what needs to happen on that construction site or what needs to be constructed. Then on those stages, you have to be busy compiling your baseline risk assessments, which you'll be dealing with task by task and what risks and hazards might be associated with those tasks and how you're going to mitigate them. For example, there might be excavation. In excavation, what might go wrong? You have to establish that. After establishing that, then you have to know how you'll make sure your employees on site are safe. Then from there, when construction commences, there's lots of factors involved. There'll be subcontractors, there'll be scaffolds, there'll be working on heights. You have to break down each and every aspect of that, making sure you know how you'll make your employees safe on site. For example, if you'll have guys working on heights, so which means they'll be working, let's take for example, on scaffolds. That's a hazard already, working on scaffold. So how do you make sure the guys working on scaffolds are safe? So which means, for example, you'll implement training. That's the first thing you must do. After implementing training, you must make sure that those guys are medically fit for working on heights. Because if they're not medically fit, something might happen. Someone might have a heart attack while working on heights. That person falls and dies. It's your own responsibility. Then from there, you must provide equipment. There's harnesses, there's shock absorbers, there's work restraint, there's lifelines. Those guys must have that while working on heights, which means as a safety officer on a construction site, those are your responsibilities to make sure you inform your employer that those equipments needs to be purchased for your employees. Because if that does not happen, someone falls and dies on site, there's possibility of imprisonment or high fines because of not complying to the Occupational Health and Safety Act. And most of important, you must make sure as well that your subcontractors, you must audit them. The health and safety files must be audited. You must make sure that they've got letter of good standing. You must make sure that their employees also are trained for that specific job which they'll be doing. Then from there, they must be medically fit as well. Because people who are not medically fit, anything might happen anytime. So which means you must have an Annexure 3 medical certificate. All right, that's a quick brief introduction of what you guys have to know. Please subscribe to the channel. I'll send another video tomorrow on tips you should follow if you're going for a health and safety interview. All right, thank you guys. Continue working safely.